Today in this lecture, we will discuss renal clearance, and we will discuss the importance of renal clearance in quantifying the different renal functions like glomerular filtration, tubular secretion, and tubular reabsorption. First of all, what is renal clearance? In simple words, renal clearance is the effectiveness of the kidneys with which the kidney is performing its function. So if the kidneys are performing the functions perfectly and effectively, then the kidneys will have very good clearance. And if there is some defect at any level, at the level of filtration, at the level of reabsorption, or at the level of excretion into the tubule, then the renal clearance will be affected. So in simple words, renal clearance is the effectiveness or the performance of the kidneys. And at the molecular microscopic level, it is the effectiveness of the nephron, because kidney is made of nephrons. And finally, it is most probably most closely related to the glomerular filtration, because clearance is mostly dependent upon the filtration. Then it is of course dependent upon tubular reabsorption and tubular secretion, which we have discussed in detail. Now, coming to the point, the definition of renal clearance is the amount of plasma that is cleared of waste material. It is the amount of plasma that is cleared of a waste material. So to take an example, we have some waste material in the plasma, and the concentration of the waste material is 1 milligram. It is 1 milligram per ml. 1 milligram of waste material per 1 ml of plasma. Now, depending upon the performance, the effectiveness, the working condition of the nephrons and the kidneys, the amount of time or needed to clear that plasma of this waste material will determine the renal clearance. And the time mostly is 1 minute. We consider mostly 1 minute. So if the kidneys are performing very good, they are very effective, they are in normal working conditions, then this 1 milligram of waste material may be removed from just 1 ml of plasma that is passing through the nephrons. But if there is some defect in the nephrons, then the same amount of waste, 1 milligram of waste, will be removed only when 2 ml of plasma passes through the nephrons, because the kidneys, the filtration process is not very effective. The filtration or the tubular reabsorption or excretion, tubular secretion or excretion process is not very effective. But if the kidneys are very much damaged, then the same 1 milligram of waste material will be removed or cleared from the plasma when 10 ml of plasma, when this much amount of plasma passes through the kidneys. So renal clearance is the amount of plasma. It is the volume of plasma that need to pass through the kidney in a unit time in order to clear a specific amount of waste. And these waste are of different types, and most commonly which we measure is the creatinine. So clearance is the amount of plasma that is cleared or that is cleaned from a waste in a unit time, or it is the amount of plasma that has to come through the kidneys in a unit time in order to clean a specific amount of waste. We have taken example of 1 milligram of waste. This 1 milligram of waste, this 1 milligram of waste, and this 1 milligram of waste, it is the same amount, but the volume of plasma that need to pass through the kidneys is different. Here it is just 1 ml. The kidneys are so good, they are performing so well that it can very rapidly clean this 1 milligram for just 1 ml of plasma that is passing. Then if they are not very good, then the volume may increase. And if the kidneys performance become very low, if the kidneys performance become very low, then the kidneys may not even be able to remove this waste in any amount of time with any amount of plasma passing through the nephrons. And then dialysis may be indicated, or some other methods of cleaning or clearance of the plasma may be needed. So the equation that we use to calculate the clearance is this equation, where we have C for clearance of the substance, which is the waste material, sometimes creatinine, sometimes some other substance, but mostly we take into account creatinine. So clearance into concentration of the substance in the plasma, clearance into concentration of the substance into plasma is equal to volume of urine formed into concentration of that substance in the urine. U for urine, P for plasma, C for clearance, and V for volume of urine. Now this equation is used to calculate the clearance. This equation is used to calculate clearance. And by adjusting this equation, when we bring this concentration of substance here, we get the clearance of the substance. Now let's take an example. We will calculate the clearance of inulin. We will calculate the clearance of inulin, and we discussed initially that we basically we are trying to measure the renal clearance. We are trying to understand the renal clearance so that we can measure different renal functions like glomerular filtration, tubular reabsorption, and tubular secretion. So we cannot directly measure the glomerular filtration. So we need these indirect methods. We can measure the plasma concentration of some substances. We can measure the volume of urine that is normally formed. We can also measure the concentration of substances in urine, but we cannot directly measure the glomerular filtration rate. So any substance which is filtered here, in the glomerulus, and then it is removed completely in the urine. For such a substance, there is no tubular reabsorption and tubular secretion, and the amount of filtration is equal to the amount of that substance that is excreted in the urine. For such substances, the clearance of such substances is equal to the GFR. The clearance of such substances is equal to the glomerular filtration rate, and one of such substances is the inulin. Inulin is a polysaccharide which, when injected into the body, it is filtered here and it is completely removed into the urine. There is no tubular reabsorption and tubular secretion. Now, for example, we take some concentrations, and we imagine that the concentration of inulin in the plasma, is 1 milligram. It is 1 milligram per ml. And after some time, we have the concentration of inulin in urine. Concentration of inulin in the urine is 125 milligram per ml. In the plasma, we have 1 milligram per ml, and in the urine, we have 125 milligram per ml. And the total amount of urine that is formed in 1 minute is 1 ml. Suppose we injected inulin into the body, and the plasma concentration became 1 milligram per ml. And then we collected urine, and the concentration of inulin in the urine became 125 milligram per ml. And when we measured the urine, the volume, the amount of urine that was formed, it was 1 ml in 1 minute. So concentration of inulin in plasma was 1, concentration of inulin in urine was 125, and the amount of urine formed in 1 minute was 1 ml. Now putting these values in this equation, it is the same equation, but here, because there is filtration but no reabsorption and no excretion, so the clearance is equal to GFR. The amount of inulin filtered here is equal to the amount of inulin excreted in the urine. So we put the values and we get the result as 125 ml. 125 ml is the clearance. It is the GFR of the GFR of this kidney. But why we are saying that the GFR, the glomerular filtration rate in 1 minute is 125 ml? Because we measured the amount of inulin in plasma, and that was 1 milligram per ml. And finally, when we measured the urine concentration, it was 125 milligram per ml, but the total amount of urine that was formed was just 1 ml. So for 125 milligram of inulin in 1 ml of urine, 125 ml of plasma must have been filtered here. 125 ml of plasma must have been filtered here, because 1 milligram is present in 1 ml. So to make 125 milligram, 125 ml must have passed through the kidneys in 1 minute. Only then the 1 ml urine can have a concentration of 125 milligram per ml. And then the GFR can only be 125 ml per minute. So that's how we calculate the GFR indirectly from the renal clearance by taking the example of inulin. But inulin is not only substance which is excreted the way it is filtered. I mean, this is not the only substance which is completely excreted. There are some other substances, and one practical thing is creatinine, which we normally measure. And through these measurements, we can determine the GFR, the glomerular filtration rate of a normal human being, or people with some pathologies in the kidneys. Otherwise, there we do not have some machine which we can fit here and which can measure the GFR in the nephrons inside the kidneys. But we can measure the amount of urine that is formed. We can easily measure the plasma concentration. We can easily measure the urine concentration of different substances. I am repeating these things so that you can understand. But if you still do not understand, kindly rewatch this video so that you have a full firm grip of this topic. And at the end of the lecture, I will repeat that clearance simply means the effectiveness, good working condition of the kidneys. With good clearance, the kidneys are working very well, and with bad clearance, the kidneys are not performing very well. And we use the clearance method to measure different substances like GFR. We have measured only glomerular filtration rate here, but we can also measure different renal functions with the help of a clearance method, and by modifying these equations. For example, we can sometimes measure, if we have the clearance, we can measure this component, we can measure this much, we can measure this, and we have other equations which we will discuss further. So that's all about the renal clearance and its use in measuring the glomerular filtration rate. Thanks a lot for watching the video.